Ladies and gentlemen, it's my great pleasure to introduce the establishment of National Biobank Consortium of Taiwan. Since Taiwan already had passed the Biobank Management Act in 2010, it's possible to legally obtain participants' approval to use their specimen and medical information, as well as to link other domestic databases for diverse biomedical research. This is so-called broad consent. This law has strict requirements for each biobank, especially on data safety. The law also has strict requirements on data and biosample application. It also has regulations for commercial benefit feedback. So the biobank can not only provide high-quality medical information and specimens for academic use, but also legally allow industry to submit applications for commercial application. This is one important niche of biobanks in Taiwan. So efficiency of all biobanks should be improved to maximize its effectiveness. As of May 20, 2021, Taiwan already has 35 biobanks being approved by the Ministry of Health and Welfare. Through the cooperation of all biobanks in Taiwan with uniform quality standards and clinical data content, a large and comprehensive human biobank network can be quickly established. Under such design, National Biobank Consortium of Taiwan was established through the fund support and governance from the government. All aliens will follow the same SOP for the material collection and have the same quality of the biosamples when submitted to the applicant. So this is a National Biobank Consortium of Taiwan, NBCT, is not a solid physical one biobank. It's actually a virtual biobank through the cloud. So it's a collaboration of the members, several biobanks. And this project started from 2019 to 2024. And we hope it can be always continue on. In 2019, National Biobank Consortium of Taiwan was formally established on October 31. Our former Vice President Chen has come to give his best wishes for this consortium. And also our Minister of Welfare and Health and Welfare, and our Liang Cizang, and all the big members have pressed down the lights to opening this NBCT, and 30 biobanks have sent their representative to attend this opening ceremony. So a central office of NBCT was set up to manage all of the administration work and to play a role as one-stop service with good efficiency. Adequate and consistent clinical data will also be established under well information security management. Since the contents of the biobank from different institutes are quite different, NBCT is able to quickly establish a large comprehensive biobank network, which is not an easy job. Currently, NBCT already successfully invited 30 biobanks to join and has more than 420,000 participants with various kinds of biosamples available for applicants. And this is the structure of the NBCT central office. We have an advisory board and have a review committee to review all the applications. And we have administration section, business section, information technology section, quality management section, mainly for the samples, and academic research section, to encourage the research activity. And this is our team member of the NBCT central office. We also have large and nice central laboratory of NBCT. And by 2021, now we already have 30 members from 30 institutes. We have 15 institutes join in 2019, and we have 10 join in 2020, and we have 5 institutes join in 2021. And this is our new website established in June this year, which has multiple functions, and you are very welcome to visit our website to check all the content and the service we have. And that one is Chinese, and this is the English website. And currently, all participants have exceeding 510,000 participants. And you can see the blood sample is the largest one. We have a plasma sample of 448,000 cases. And for tumor cases, we have more than 70,000. For the non-tumor case, we have more than 430,000 cases. And you see this all item in our website. You can check our recruited contents. So this is the English, the enrollment. You can see what kind of organ site and what kind of sample we have. And for like this one, for example, in the cecum, we have 1,809 cases. And for this one, see the liver, we have blood sample of 34,000 cases and frozen tissue for 7,000 cases. So that's quite a lot. And we also can have an inquiry section. In this inquiry section, you can key in what kind of organ site, what kind of disease, what kind of age, and you want, and gender, and what kind of sample, and submit your request. Then we will answer your request sample, how many cases, and you can decide whether you want to make application or not. Also, when you want to check the organ site and the disease code, we also have this one. This is information section. You can check all the organ site, the coding, and the diagnosis coding. And this is example. You can see the organ site and diagnosis coding. You can also, not just coding, you can key in the word, like skin, basal cell carcinoma, and instead of give the code. And this is the non-tumor part. Also, for all application, we'll give basic clinical information. And you can check what kind of basic clinical information we can give. You can download. And also, we have established the SOP of all kind of specimen application, processing, and transferring. And this all SOP was, you can download here. And this for application, you can application online or download application form and mail to us. So we also have a COVID-19 biobank section. And by August, we have already 457, and now we already 476 samples, and you are very welcome to apply for them. And this is the content of our SOP. We have 12 SOP for all the specimen standardization. And in addition to the specimen standardization, we also have standardized information. So to this NBCT is not just to improve the quality, the standard, we also want to improve the biobank associated regulation to make it more feasible and more convenient, more efficient. So we have established National Biological Bank developed medical big data platform. So the final goal of NBCT, National Biobank Consortium of Taiwan, will also pay attention to the value-added service to further increase the importance of this biobank network, further expanding the database in this biobank consortium. You see, the database is most important. The goal of NBCT is to build a huge and comprehensive biomedical big data network research in line with the need of biotechnology, pharmaceutical, AI, auxiliary medical, and other industry. And thank you very much for your attention.